just got done with my EMG with that jerk. He made me cry. I got teary-eyed. I had to stop myself from really breaking down though. Because he's just there to do his job. He made that very abundantly clear. Let me just do my job. He told me that like 2 to 3 times. I have to remember who I'm talking to. I got to be able to read the room with my Asperger's and stuff. It's just, you know, I always try to hope for the best, and hope that. And I've seen this mother trucker before, but not for the test. But this test was absolutely horrendous. I'm just too sensitive for this type of doctor. I'm just too sensitive. I admit it. I am. I'm just too sensitive, and just so much PTSD. I wished I could have had some of the good experiences that I've had in the past with some of this stuff. This doctor just was, his job is to come in that room, ask the minimum, don't let the patient elaborate on anything else. It's time to just get the job done, put the things on, have no compassion or bedside manner for that patient, for what they're going through. He's there just to do a job, administer their test, and send you on your way, and send the results to your doctor. Not answer questions. Even when he asked if I had any questions, I asked the question, and he's like, let me do my job. What was the point of saying ask a question when you're just gonna shoot it down, you stupid mother trucker? I don't deserve this fucking treatment from these assholes. Thank goodness I can take my meds. I wish I could have taken them beforehand, but I needed to give honest, true results that weren't going to be affecting my system. I was so positive in my first post on the way here. I knew who I was working with. I knew who he was. But he allowed me to at least elaborate a teeny bit during that last appointment. But for this type of appointment, no. It's just no questions. Just basically let me do my job. What's the point of asking how you're doing? I'm in pain. Okay. But he did not take any of that into consideration. The only thing he fucking did for me, he noticed I was starting to get teary-eyed. I didn't even think he'd flippin' notice, because he was too busy just doing his job. He handed me a damn tissue. That's about the amount of compassion I could get from this mother trucker. I almost wanted to just throw it back in his face and just be like, F you. I tried to give him information about, like, just having my arm in that position. I was having numbness and tingling in the palm of my hand. He was just like, let me do my job. He doesn't care. Why do doctors get into this profession if they don't care about their patients? I just don't get it. I'm too sensitive. I'm too much of an empath. And I pick up on these stupid, robotic, not-feeling mother truckers. I don't care. I wish I wasn't so damn sensitive. But I am. And I'm going to be stronger for it, because I can show other people the compassion that doctors don't. And I wish they would. I'd like to say I'm taking one for the team, but nobody should take one for the team when it comes to this stuff. They should. Practice breathing, Jenna. Practice breathing. Breathe. Don't hyperventilate. I can't hold in these feelings. I had to hold them in for about, it seemed like a half hour. And just holding it in for that long makes me outburst like this. I'm not meant to hold in my feelings. I have no skin anymore to protect myself from this kind of effect. The PTSD is so bad. This too shall pass. These feelings will change. I have to just feel them and let myself be uncomfortable and allow my audience to be uncomfortable watching me have this crying meltdown. And this is how we get treated. Nobody deserves this, man. Nobody deserves it like this. I wished I could have a thicker skin. I wished I could be like him and have no flippin' feelings or show no emotion, except for putting me in my place. He's the doctor, I'm the patient. I don't need to know anything. I just need to know that he's just administering the test. That's all. And I kept trying to like justify why he's treating me this way. And I'm like, he is. He's just doing his job. He's doing what he's paid for. That's it. He's not a doctor that cares about his patients. He's there just to give prescriptions and just give his opinion. Even though none of my other symptoms matter, because what matters is just sending the shocks through my nerves. Which, let me talk about how my EMG went, so I can try and still process my feelings at the same time, but like allow them to process little by little. So how I think the EMG exam went, I have no clue, but now all I'm going to do for the rest of the day to help cope is learn about EMGs, read up and refresh myself about what results could mean, what could happen if I have positive results, what would happen if I have negative results. Normally, in the past, I have had compassionate doctors. I have had doctors conduct these nerve conduction tests and care about their patients, and the experience is totally different. And I tell you what I'm going to do. I am going to go online. I am going to badmouth this doctor. I'm going to highly not recommend him. I'm going to give him crappy reviews. I may actually do this under 2 or 3 different email addresses because I want to make the point across. And I will never, if it wasn't needed, and I knew it was going to be him, and I didn't want to see him, but he just reaffirms that I will never, ever go back to him again for anything, and I will avoid that office like the plague. I will not allow any other doctor from that place. Even if there are good doctors within that facility, I will drive out of town. I will drive 300 miles. I will drive as far as it takes for me to get a compassionate, caring person again. I've allowed myself to try and trust medical doctors again. I am trying to get through this PTSD. I'm feeling my feelings about it. I'm going to take action by writing bad reviews, so hopefully I can help others make better decisions than me. But I know that there's a wait list at many places. There's wait lists. And I just need a down day. I need to process all of this today. I don't know if I can make my phone calls. Maybe I'll have the courage to later. But right now I'm just really defeated feeling. Because I've allowed him to alter my mood and my feelings for the day. I allowed him in because I needed to get this test done. And I kept just reminding myself as tears were coming down my eyes, he's doing his job, he's doing what he's supposed to do. And that's how I have to think about it. I had to think about it like that just to be able to get through the appointment so I could feel my feelings afterwards. That is how PTSD is created. You get shut down. You're not allowed to feel your feelings. He gave me a tissue, so I guess I was allowed to have feelings in there. But when I had feelings, he asked me if I wanted to stop, and it's like, no. I will suffer through this. I will be strong, and I will make it through the end. Regardless of my feelings about him, I kept repeating in my head, I hate you, I hate you, I hate you. You're a stupid cuss word, cuss word, cuss word, cuss word, cuss word. And then I kept, to cope with this during the EMG, I just was like, this is necessary. I just needed to be the patient he was requesting me to be. And then I no longer have to deal with him ever again. So I can rest assured I won't deal with him ever again. He said it'll take him a couple of days to write this report. That is BS. He already knows the results as he's going through it. He's a professional. He does this all the time. He already knows what the results are. But if he was a good doctor that cared about his patients and allowed their patients to ask questions and communicate what I'm feeling as the feelings happen, to try and give more information, but it wasn't needed because he has all the information he needed because he had the test. He had the electrodes. That's all he needed to know. He didn't need any other information because that's not his job. His job was to conduct that test and that only. So, that is what I understand from that. But I already knew beforehand that I have loss of sensation on half of my body. My right side of my body is asymmetrical in feelings and sensations than my left. And depending on how my body goes out of alignment determines which side is affected more. Regardless of sensations feeling different on the right side versus the left, I still experience a lot of pain. It's just a very slight difference in variation in pain, and pain signals are different on one side versus the other. Granted, I have Chiari malformation, which is pressing on my spinal cord, which is affecting my brain because it's part of my brain. So part of my brain is being squished, which controls procipitation, which means where you're aware of where your body is in space, within the earth, within your area, within your body. It controls that. It controls balance. That part of the brain that is squished in me controls those things, which also were the most common places that everything goes out of alignment. They affect my breathing. They affect the sympathetic nervous system. So it also can entrap the vagus nerve, but it also messes with different cranial nerves, which affect different parts of my brain, which will inflame different parts of my brain at various times of day, weeks, months. Sometimes it depends on how long I stay out of alignment in that area. That's why I go to the chiropractor as frequently as I do, because I fall directly right out of place because there's still something wrong along my spine. And there is nothing that will fix it except for surgery. And I basically do have to have exploratory surgery all along my spine, because I don't know if they're going to be able to see it, because I can't see it on the MRI so far, but the thing that they could see was a cord deformity, which very well affects me. It affected me before surgery, and it's affected me now again since my fall, and now that I have a bulging disc again. It is affecting me, and doctors just don't know enough about any of that, because they don't treat patients like me, because they don't pay attention to the signs of the body and take everything into account. I started writing this in my description of my first video of the morning, and I talked a little bit about that. I should have had that context in the description of this video, but I decided to just stop writing and just make a video about it, because I need to talk about it, but I also needed to match the score. It remembers, and it has the same symptoms, and it's showing the same signs within my blood work. And I only know because I've been observing my blood work and my body and my symptoms since 2010. I have been studying and learning about my body for the last 14 years and being able to correlate so much with what I've experienced and correlating with doctors and correlating with test results and seeing the difference in test results before surgery, after my fall. And all of the same things are happening, and they're progressing worse the second time around. And I learned that with one of my last study sessions about tethered cord is the second time around the symptoms could be worse, and they are. But I also have a lot more bulges, and so that's making things worse. And it's making things progress further, where I mentioned in my first video, I'm starting to prolapse in my anus. God, I hate saying those words. Sorry, God, for using your word to me. I'm just tired of it, guys. I'm tired of having to do all the work myself. But it is making me that much stronger, and it's making me who I am, and it's building my motivation and confidence up to continue going forward with this. I know what I know. And these doctors don't know crap. I am too smart for my own good, and I know too much. And these doctors don't know enough. And it drives a person crazy because they know, and they know what they need, and they know what they want. It's just getting from point A to B, and you have to play these doctors' games, and you have to let them mess with your head. You have to listen, shut up, do what they say, otherwise they won't work with you. They'll just stop. And you have every right to stop it too. But it is too important to me to have these results. So that trumps my feelings every time as I'm dealing with my PTSD from all this gaslighting and the treatment that I get from these doctors because they just don't get it. This doctor has all kinds of other pain. I know that because he has a flipping cane. He walks in with a limp. He's jacked up in the spine. And he's a doctor. How can he not have a full turnaround? How can he give advice to other people? And how can he have no compassion for others? Because he's not accepting his own problem. He's living with it, and he's just dealing with it in his only way he knows how. And that's just to turn off all emotions and not to deal and process his own emotions about his own disability. And I'm making huge assumptions here. And this could not be the case at all, but this is how I see it. And this is my opinion of him. And I have every right to have my opinion, even if I'm wrong. But from how I see it, people that don't have empathy or compassion and just that are like it, I feel like they're sociopaths. A lot of these doctors are sociopaths, narcissists, egotistical jerks. And they should not work with patients. Every doctor needs to go to PTSD training, that is for damn sure. And that is something I am going to be very passionate for and fight for after I get through this hell tethered cord mess. And hopefully I come out on the other side stronger and better and happier and better quality of life. I could end up with worse quality of life. Who fucking knows? Sorry. Freaking knows. I really try to keep my cuss words out of this. I don't want it flagged. I want to be able to have the algorithm push my content because of cuss words. I'm still working on that. It's hard because I'm triggered right now. It's hard because I'm triggered and I have such a morbid sense of humor about things because I got to be. I've got to learn humility. I wish these doctors would learn humility as well. So I will learn for them, and I will try to my best to just inspire others to I hate to say it, you have to push your feelings aside. If you want results and you want forward progression in your medical care, you've got to deal with the gaslighting and the traumatizing, but learning how to cope and feel your feelings is the most important way. And the takeaway from all of this presentation, as one of my newer commenters would say, thank you for the presentation. I didn't view my videos as presentations, but I guess I do now. I mean, because, well, I'm getting told that, so the more I get told that, the more I believe it. So yeah, here's my presentation for y'all. The takeaway from this video is you've got to play the freaking games of these doctors, but you also have a choice in what doctors you see. I didn't do my research ahead of time, and I am in a time crunch because of my symptoms. I just had to take what I could get at the moment, and unfortunately, it's not always going to be preventable. I'm going to have to just learn to use my coping mechanisms and behaviors of rewiring my brain, changing my viewpoint, and changing my own perspective about the experience I had, to turn it into a learning experience and a teaching experience, to warn others, but also inspire others. If you really want results, you've got to get some thick skin. You've got to learn how to have less sensitivities, and you have to have boundaries. And, once he shut me down 2 to 3 times, I learned my lesson in today's appointment. I just keep my mouth shut and just get it over with. The faster I don't say anything, the faster he can get through the test and get me out of there. Because that was my goal, was to just, I have to remember who the doctor is. I have to act accordingly per doctor, and I have to essentially be an actress. I have to learn to be an actress and mask my true feelings about that doctor. And sometimes doctors do change their tune with a patient, just changes their tune too. So it's all a matter of attitude and perspective and how you come across to certain doctors. I did not make a very good second impression, but I don't think he even remembers me from the first time. He treated me like I was a brand new patient, like he'd never seen me before. And I took that as a grain of salt, because I'm like, yeah, he does probably see hundreds of patients. I mean, don't hold that against her. That's just who she is, and that makes her who she is. And I love my mom, regardless of, you know, those things that I see in her, that those certain observations, opinions of her that I have. She does show me love, but it takes a lot for me to get it from her. I just had to learn to communicate more effectively in terms that she acknowledges, because she doesn't always acknowledge all of my everything, but it's okay. I am glad that I have my mom and dad in my life. I would never, ever be estranged from them. I used to talk to my mom every day, even after I got tattoos, and she was all against tattoos, and I kind of did get a tattoo out of spite at the age of 18, because I've been working on my mom my entire life and trying to help change her. I need to stop trying to change my mom. My mom is who she is, but I always thought I could change her, and it's not necessarily changing her, it's helping her understand other aspects and perspectives in life. She's not very open-minded. She's more closed-minded. My dad is more open-minded than my mom, but due to his age, he's a little closed-minded in some areas as well, because he's set in his ways, because he's an adult. He has every right to have the opinions and express himself, or not express himself, however he wants. But I really do respect my dad, and I love my dad to bits, even though he has some annoying tendencies of being a messy slob, and he's a hoarder. So I have some of those tendencies myself too. But they're not really negative things. They're observations, and I'm just describing the terms that I know and associate with my parents. They're great people. I love them. And, you know, to finally hear a little bit about Celia's story, thank you if you were watching this video. I just want to call them out when I talk about them and acknowledge that if they are watching, this is positive stuff. Some people like anonymity to stay anonymous, but it's important for them to share their stories, but at the pace that they're ready to share them. So I'm never going to traumatized by the person that administered it. But now I can actually talk without crying about it. See what a difference it makes by writing it down on a description on another video, and then having my feelings and showing you all how to be vulnerable, and then look how being vulnerable can help a person change the way they think and talk, and their mood can change. It's all in how you respond to your own feelings. But when you're in PTSD shutdown, your reptilian brain, thank you, Celia, for reminding me of my mental health part of my journey. They call it the reptilian brain because it's old and it's the first part of the brain that they learn about. And I can't remember the proper name of it. My brain fog and my dyslexia, I mix things up all the time. Like terminology, which is still one of my pet peeves with my mom. I brought it up to my dad yesterday. That's the only reason I'm bringing it up now, is just so I can talk about it again. Because the more I talk about the same thing, the better I feel about it. And if I can tell more people and tell people my story, the better I feel. Seriously, I feel so much better and more motivated to get more done now that I've talked about this. I've changed my brain in the last 30 minutes, because I'm at 33-minute mark now. It's taken me 30 minutes to really start to change my brain. And sometimes it can be faster, sometimes it can take a lot longer. It depends on how shut down I can get. But if I can remedy it immediately, like I did, I started feeling my feelings right away. I started writing about it, and I started talking about it almost immediately. So now the trauma, instead of being like this, is now like this. And it seriously helps you change your brain, and it creates new brain connections, and receptors in your brain get turned on when you learn to think about things in a different way. And having an open mind to be able to think openly about it and think differently. But as patients, professional patients like me and Celia and some of my other friends, we get so put down, and the only experiences we experience in life are doctors that are not cooperating, and so you're constantly in the state of your logical brain is shut down. You're just reacting to everything, and usually it's not a good reaction. It's a negative reaction because you're so traumatized and your logic brain is shut off. You start to dissociate. You don't have any feelings to feel anymore. You can't cry, but then you also can't be happy. And so no matter how hard you try to change your feelings, your body keeps the score and it holds on to it. So if you don't feel your feelings about how you feel about everything, and you don't talk about it, you don't have a support system, you don't have a therapist, you don't have anybody, doctors included, supporting you. And due to Celia's unique situation, she can only be out at night. She cannot go anywhere at all except for at nighttime. Can you imagine living a life at just night? Never really being able to get the vitamin D and the happy stuff to help support serotonin and dopamine in your brain, because you have imbalances in vitamins and deficiencies and such, and you have a body that's just breaking down and not functioning. I've got to do some more research, and I know she has researched her butt off, but there's people out there that are living with things that are not talking about it. Celia's gotten to the point where she's doing nothing but talk about it all the time, and she's just stuck in this cycle because she hasn't found any results and has not gotten any positive rewards for anything that she's done. And she makes phone calls all day long, and she's like ramped up, and then she has insomnia, understand all of this and being able to try and communicate that I have been through those situations too. It's hard for people to comprehend that somebody else feels this way too. You feel so alone, you feel isolated because all you're doing is being cast out by doctors, and then you have nobody that's supportive because people don't want to be Debbie Downer, so then they want to isolate and they don't want to bring people down and make them have the same low vibration energy that they have, because that's where they're stuck, because they're not getting progress and they're just stuck in this low vibration state of energy. And so it's easy to be an energy vampire and try and suck it away from people that are positive, but people that aren't strong enough to be able to cope with watching a loved one suffer and go through these things. But then to have some of the closest people in your life, and I'm not naming who, but to have nobody, to be a 31-year-old woman with nobody that understands what's going on, including doctors, because she has one of the most rarest things I've ever heard of. I don't know nothing about it. Nothing. And until I meet her in person, I don't really even fully comprehend it, but I'm not discounting it by any means. I'm there to listen to her about it, and I'm there to help try and validate her that she's not crazy. She may have some bouts of craziness because of the way she's treated, but that's out of her control. It's her reptilian brain taking over, and she's just in a state of stuck reactionary issues. So it's not easy. She's dying for social interaction, but at the same time she doesn't want social interaction because all it is negative with her. So it's understandable. Very understandable, Celia. I understand and get it. I've seen it all too much, and I've experienced a lot of it, and I have also reacted the same way from PTSD. And the more people I know with PTSD and medical gaslighting and such like this, we all end up, really just distraught and stuck. But there are ways out of it, and she feels like there is no hope. And I don't know, and I'm not going to give her false hope about what's happening to her, because I don't know. And I think that's what doctors have a problem with too, is they just don't know. And her situation is so much more unique than mine that it's I just want to try and find somebody, I just want to bring awareness to it. Her skin is disintegrating. It's necrosing, not necrosing, but disintegrating. Like, I don't know the right word to use for it. Until I see it, I'm going to go, when I meet her in real life, I'm going to see it. I'm going to have to make like some slumber party nights and go hang out with her, and maybe nap during the day and stuff, and then make a night to go up there. And I want to be with her, and I want to provide some support, even for a brief amount of time. I just want to support her. I want us to laugh together, even if it's just temporary, and she may not be able to feel the happiness deep down. It'll be more surface level happiness, but to just have some kind of anything happiness. That's what I'm here for, is to try and show her how to get there for herself. Because what I did for myself, not everybody can do, and everybody goes about things differently. Not everybody works the same. Everybody's brains are different. But what is the same is PTSD shuts down certain parts of the brain that you just can't do anything to help it, except for learning coping techniques. But even then, your logic brain is shut down, so you can't even think of logically. Thankfully, I wasn't too triggered, and I was able to do what I did with my description and then talk about it on video. And so thank you guys for being here for my therapy session to help me learn how to cope with this appointment this morning. It's all I can think about still until I can distract myself with other things today, but also still feel my feelings. I may end up crying a couple more times, we'll see, I don't know, but at least for the next hour or so until the meds kick in fully, you know, we'll see what happens. We'll see how long I may or may not get stuck in this trigger. I feel like I can move on though, but we'll see. I mean, the brain is so malleable, it can change. Some doctors would think that maybe I have a mood disorder and put me on a mood stabilizer may help, but I'm like, I like being me. Why? I don't need to change me by taking a medication that's going to alter my brain activity. Besides anxiety medication that alters and helps downregulate the central nervous system, which at the thoracic 4 level, that's right where the heart is in the front. And so having things, the cord deformity right at that part of my spine is really bad news. I mean, I'm starting to prolapse down my butt, you know? There's too much tension and things are getting too loose because my body's trying to adapt for the maladaptive functioning that it's functioning at. I've got to do something before it's irreversible and I have to have stupid butt prolapse freaking surgery. I hope it doesn't get to that point. I'm hoping my EDS will be a saving grace, but I really need to have physical therapy. I need to get, I'm getting on that VA message today. I have to ask her for that referral. Maybe I'm gonna drive to ProMotion today in town, and I'm gonna see if they accept VA insurance, and then ask them what information I need to get so that I can get the referral approved. I'll message my VA doctor. I'll get a response sometime next week, so hopefully I just didn't want to overwhelm my doctor with too much because the necessity of getting this surgery going is priority. And then upkeep up until surgery is where the physical therapy is going to come into play, because I've got to try and stop this prolapse from happening fully. I have to. I am not going to deal with a prolapse surgery. I don't need that added problem. I don't need more scar tissue. I don't need only one specific surgery, and I feel like they just really need to look at my entire spine. I don't know what we need to do for that, and that's why I'm seeking this specialist in Rhode Island. I need her to understand what tests I need to get so we can find out what to do. Oh, another answer. Hang up. It almost hung up on my freaking video. So please don't call again and interrupt my video. I'm in my car. Oh, I need to turn my Bluetooth off. Shoot. Because my Bluetooth will automatically answer it. But I want my AC on. I'm sitting in my car. I don't want to go in the house yet. I want to finish up this video before I go inside. Because it's harder doing videos inside the house without turning the camera. I like having the camera like this, but it's just harder to do with videos inside the house like this. Just trying to get good, setting my phone down in the proper place to be able to do my talk still. And this is a tough situation. It's a tough situation. Gosh dang it. As much as I need to finish setting up this referral from neurosurgery, I need to work on that first. Then I can talk about the physical therapy, but it's so hard to manage, guys, because this is what happens is I overwhelm the doctors, and then they're multitasking too many things all at once, and then things get convoluted and confusing, and then they're like, what are we doing? I can't start off on a confusing note with this doctor with doing too much at once, and I also don't want to overwhelm myself with trying to do too much at once, because it's hard enough just getting the authorization set up for certain doctors, but I need to make phone calls and follow through with those. God, I wish I could just. Sorry, God, I love you. Please help me get through this. I just want to get through this. And I need to follow through with my referrals first, get the authorizations done. I need to get on my computer, but I need to also clear off my computer and work with get my clothes put away, get my beading stuff put away. Like, I have to do things in order, so maybe I do have some type of signs of OCD, because they have to be done in a certain way, in a certain order, for me to feel comfortable and not overwhelmed, because there's just too much I need to do, and I need to finish a task before I start a new one. I can't multitask too many things all at once, and I just need to write them on a list in a priority sense, and then go down the list so I can work on it that way. And that helps with my ADHD and overwhelm, like meltdowns of being overstimulated by doing too much at once. I have to process one thing at a time, but it's so hard because my mind is all over the place about I need to do this, I need to do that, and it's just, maybe I need to change my ADHD meds. Maybe they just aren't working enough. Maybe I'm not taking the right dose. I don't know. Maybe it's just the PTSD and the trauma that's ramping me up, that's keeping me and my immune system ramped up too high. It could be my mast cell activation syndrome that is keeping, there's extra stressors with that help my body function worse. There's just so many things to factor in, and it's hard to figure out what is priority besides surgery. MRI, what MRI do I need? What testing do I need besides the typical MRI and then the typical nerve conduction test? Now I need to move on to getting maybe a small fiber neuropathy one. Maybe I need to get some nerve conduction on my lower extremities. I need to wait and get the results back, so sometime next week I'll get the results in my chart. Hopefully I'll see them in my chart, my chart. Hopefully they'll put them in there before I see my doctor. Hopefully that'll help calm my anxiety about the results. But until then, I'm going to do a whole bunch of studying about nerve conduction tests, nerve studies, what results could mean, what can I do to rule out other parts of my body depending on what the results tell me from this test. I need to be prepared for plan B and C if these results come back normal. Because I'm very used to doctors gaslighting me. I've already been gaslighted a couple times by my Medicare doctors this year. But they didn't affect me as bad because I have better coping now, and I have anxiety meds now to help me downregulate my central nervous system, which is overloaded with extra stimulus and extra everyday tasks that I have to do on top of do what my mom asks when she asks to do it, and then trying to find times to have fun times, and trying to socialize, and trying to do family events and family dinners, but then it's trying to balance time with friends. And then do I cancel my plans with my friends? Do I have the gas money? Do I have the money to go do anything? Do I have access to borrow money from somebody? Do I have enough money to pay for all my patches and all my bills that are going to come out in the next week? Like, there's all these like regular everyday adulting factors on top of this chronic signs and symptoms of problems. I'm feeling in pain, and I'm dragging my right foot because my right leg is longer than the left leg because my pelvic bone and my hip bones are like misaligned because I have hip dysplasia and the right hip and ball and socket malformation on my ball and socket joint. My ball isn't like completely round. It's more like a football now. But it hasn't warranted hip surgery, and I'm glad I didn't get hip surgery because now I still think it's tethered cord. But I was still having hip issues after tethered cord surgery, but the low dose naltrexone that I was on was actually helping that pain, so I really didn't need to have hip surgery because the naltrexone was helping it. And then this pain patch helps everything this much, but if it didn't have this patch, I would be really depressed in a deep hole in bed, and I wouldn't be doing hardly anything because I'd be too painful. I just know how I am. I'm a big baby when it comes to a lot of pain like that. And my pain isn't really manageable at times, even with this patch. It's just not manageable. I have this numbness and tingling. I have pin pricks. I have needle pricks, nerve pain all over my body at various times. And there's sharp, like needle, like today it was in my chest, like on the left side. I was having muscle twitching in my left arm as he was doing my nerve conduction on my right arm. I didn't bring it up because every time I brought up anything, he's just like, basically, shut up, let me do my job. He didn't say shut up, but let me do my job. So, basically, shut up. You don't need, he is doing his job. That's all he needed to do. He didn't need to listen to me. He only needed to ask a couple questions, and that's how my veteran exams go. And that's why I'm triggered by my veteran exams, because they need to be able to elaborate and give me the appropriate freaking information for the VA to make a determination, because everything plays a role in it. So you want to deny me for carrying my information? Well, you know what, maybe I'm going to start trying to claim other conditions that are associated with my Chiari. Maybe I'll start going after compensation for other conditions. You want to freaking mess with me? I'm going to freaking mess with you all. And Veterans Administration common pen people. Those mother truckers are evil and they're stupid, and they're right back to where they used to be when I first got out of service. And they're using providers that are contracted out, and I have every right to ask for different doctors. So I'm going to keep asking for a specialist that knows about it. So I'm going to go get on the phone. I'm going to go give my mom the rundown of how it went today. Feel my feelings with her, get a hug, because I need that physical contact and reassurance and some nurturing right now for what I went through. I need some physical contact with somebody. Usually with PTSD, people isolate because they already feel all alone, because things are happening to them that they don't feel like happen to anybody else. But in fact they do, but they feel very alone when they're triggered. And certainly that is a couple of people I know. And only when I can start to validate them do they really start crying. I make people cry because they're like, I had no idea you felt the same way. I thought I was all alone in this. No. And they're crying because of that. I can help bring out feelings in people because they need to feel those feelings. They're holding on to these feelings, and then it just turns to anger, and then you have no happiness in life because you're so angry because you are all alone. And then you push everybody away from you because you don't want to be a Debbie Downer to them. So you don't want other people to feel bad for them. They aren't looking for a pity party. They've already been made to feel like they're attention seekers. That's what doctors are accusing them of, being attention seekers. You're just trying to get attention. You're being dramatic or being extra. Well, it kind of comes with the territory when you have PTSD and you have Asperger's and ADHD. That comes with the territory, you mother truckers. Being extra comes with being neurospicy. But that is also a superpower of ours, if we allow it to be a superpower and not a negative thing. But allowing yourself to learn, because people on the spectrum love to learn, but everybody's brain is different with what their special interests and what they want to learn and love to learn. And when it gets to the point when people can no longer do the things that they can enjoy that does make them happy, that's a problem. That's a problem. And they don't only need therapy, but they need to learn how to help and advocate for themselves. And some people already do try, but then they're shot down, and they advocate and advocate and advocate and get nowhere. And then you're just so like down in the dumps because you've done everything that you can think of, so you are all alone. And until you can find somebody that's been through the same experience like me, boy do you feel alone. But when you get to talking with me and you can and you have any kind of health issue, any issue at all, I know a teeny bit about it. I'd be almost like a family medicine doctor because I only know a little bit about everything. But due to my dyslexia, I mix up things. So I have to refresh myself repeatedly about what things are like. And so I'm not seeing this, I'm not really a doctor. And so that's how doctors learn, though, is by their patients. Doctors learn through their patients, but some of them refuse to learn from their patients, and they just go with what they know and their experiences with other patients. And when they don't see a typical patient, somebody like EDS or something very rare that only 2 people in the freaking world have ever been known to have it, like one of my friends, it's disintegrating skin from a freaking drug interaction, and there's nothing to do, this thought to be irreversible. I don't see how it could be irreversible, though. It's not that I don't believe her. I do believe her, because I believe in what people tell me. Until you tell me otherwise, I believe you. I don't think you're a liar. And so that's the difference between me and other doctors, and how people actually feel comfortable talking to me about stuff like that, is because I listen, and I'm not here to judge. I'm not here to tell you that you're wrong. I'm here to help validate you and thank you for sharing your experience, because I'm learning from their experience. I'm learning from them just as much as they're hopefully learning from me. That is my goal. I just want to help people understand themselves as much as I want to help understand myself. So it's kind of a win-win situation for me. It's helping me understand me more, and it's helping me understand others more. And that's why I love learning people's stories, because I can always find something that I can relate to with their story, because I've been through so much and have so many experiences to share, that my goal is to be worldwide. I want the world to know what this is like. I'm not trying to glamorize it. I'm not. I'm showing you all for awareness. This is awareness of what this is like to live like this. It's not fun. But I have to have a sense of humor about it, because it's the only way to get through, and laughter and happiness. That's part of the ADHD emotional dysregulation. I can dysregulate it as much as I want to. It's learning how to manipulate your own dysfunctional dysregulation. You can manipulate your own body and system. You can manifest things to happen. Not magically. I mean, no, you cannot cure your own cancer. You can't, but you can help your body heal. Your body is always trying to heal. No matter what, it's trying to heal. And it will do whatever it takes to keep surviving, even if it starts shutting other things down. It's trying to save you. Your body is trying to save your life. It's up to you to learn how to decipher those symptoms. And it's up to the doctors to freaking listen to what you have to say. But due to time restrictions and due to limitations in medicine, they don't have time to listen to patients anymore. That is the major problem in the healthcare system, and PTSD and medical problem, PTSD, with almost every patient now since COVID. Isolation messed up people's mental health because of isolation. We are not meant to isolate, but we tend to want to isolate, and then we get social anxiety because we have isolated, and we forget what it's like to socialize because we're so used to doctors gaslighting us and being negative. That's the only interactions we have with people on the outside world, is interactions with negative doctors. So how can you have any kind of positive mentality if that's all you experience? If that's all you experience. Seriously, that's all this person experiences, is just negativity. And I was there at one point too. That's all I could talk about is my medical stuff, over and over and over again. I couldn't talk about anything else. I couldn't get it off my mind. I couldn't stop thinking about it because the doctors were just not helpful. They were gaslighting me. They were telling me it's all in my head. They were misdiagnosing me. They were throwing diagnoses at me and throwing pills at me, and they weren't trying to solve the problem. They were just trying to cover up the problem, and that's what the practice of medicine does. That's all they do. They cover up the problem with medication. They don't try to figure out what is causing the problem. They just know what the problem is, and they know to throw medicine at it, because that will help reverse the problem or symptoms. But it also creates other problems in your body, so it may help one thing. So that's why they always say weigh the risk versus risk, bonus versus not bonus. You gotta weigh your options. Is it really worth the other side effects, or is it worth trying to do changes in your life to do things naturally to help your body, instead of putting more drugs and chemicals and problems in it that can help shut down your liver and kidney function and cause more problems because your body's on too much medication, and then your body becomes allergic like mine does to all antibiotics and NSAIDs. So I'm just waiting for the drop of a hat for my allergies to come in for my other medication, like bad side effects from thyroid medication. That's why I refuse to take it, because it gives me other side effects. They aren't getting to the root problem. The root problem is in my bone marrow. The root problem is in my spinal cord. The root problem is in my blood vessels and my blood cells. And now I have high cholesterol, so it's making these red blood cells larger, but I have fewer red blood cells. But to compensate for being fewer, my blood cells, instead of being regular size, they're like this now, because they are trying to keep my body functioning at the same level as it was with this, like an average amount of red blood cells. And so something in my body is destroying my red blood cells. There's something that's causing that to happen. So I would think logically there is some kind of blockage somewhere. Now I'm getting cholesterol blockages, which is not good. So I'm really high stroke risk, and I'm not. It's been extremely hard not eating any damn cheese, and I'm trying to fix my diet, and I got to see where it's at with a fasting with my next primary care doctor appointment. Not my VA one, but my Medicare one. So that's on the books. I need to write that down in my thing about, that's what I need to talk to him about. I have to take notes about what I need to talk to the doctors about, so when it gets to that point in time, I remember. Because my brain moves so fast, I'm already thinking about the next topic. So that's how it is with ADHD. And my mind is always going and thinking and coming up with conclusions and assumptions and ideas, and it's hard to shut that down. I don't want to shut it down. I want it to be like that, because that's how my brain works. I feel like I'm being punished for having ADHD and Asperger's at times, sometimes by my own family, because I'm like, stop being so impatient with me. It triggers me, and it makes me rush around, and then I get injured, and then I'm mad because I'm hurt, physically hurt, because I rushed around, and then I banged myself up or fell, or I hurt myself because I was in a hurry. Instead of listening to my body and being slow, I'm letting my environment dictate how I respond, and how my body and my brain just change, because my environment around me is making me feel like it's my fault that I'm disabled, like it's my fault that my time management sucks. My mom's biggest pet peeve is my dad and I taking forever to get ready. She hates that we procrastinate. That's her problem. It's not a us problem. But when she takes that tone with me, or when she has that passive aggressive like impatience of like, it needs to be done now, it's a huge trigger for me, because it brings out my insecurities and disability. It brings me down with my ADHD, of my time management. You know, my time management does suck, but it's one of her biggest problems with us, when it really is her problem. She doesn't know how to manage her emotions with being impatient. She is like a very impatient person as she's aged. She's just gotten more and more impatient as she's gotten older, and she's gotten to the point where she's like kind of rude to other people's kids, and she has nothing to do with kids. She don't like kids. And I'm just like, that's it's sad. It's sad that my mom doesn't like kids. Like, she is so impatient now. I'm not even glad that she had me young, because she didn't have the patience because she wasn't medicated then. She's medicated now, but she still has those breakthrough moments of her core self of just passive aggressiveness, trying to get me and my dad to hurry, but she's expressing her emotions the way she knows how to cope. And but that triggers me. It brings me back to my childhood of feeling bad because I'm always late and procrastinating. And she used to always harp on my dad's family being late. Like, they're always late. They're always late. She hated that. She wants to be on time. She's like, it's the OCD. She's a perfectionist. She's never late. You know, she's on top of it. She's got to be in control of everything. And when things are not done when she wants it done, she gets pissed and she takes it out on other people. Or her passive aggressive way of coping with her emotions is just like slamming things around, going out in the car, you know, and then like chastising us for being late. Like, really, you know, it's that kind of behavior that she shows me that it triggers me to none other. And I recognize when I get triggered, and sometimes I do go off on her too, but I immediately apologize. Not that apologizing makes anything any better. Actions speak louder than words, and it's totally true. She doesn't even have to say anything. It's her body language, it's her slamming things around, and it makes me feel like I'm just not wanted. It just makes me feel not wanted, and she doesn't love me. You know, that's what it makes me feel like. I know she loves me. You know, that doesn't change. She'll always love me, but she can have impatience, and that's her problem, but it affects me. I need to learn how to not let that affect me that way. I don't know what I need to do to try and cope with that behavior, so maybe that's something I need to talk to a therapist about how to navigate that trigger. Because as you can see, I'm still a little teary-eyed about it. I'm still not sure how to cope with that behavior, and how I can respond to make the situation better. I just try to avoid her when she's like that. But I'm also one that wants to fix the problem, and like, I don't like people to be unhappy with me, but I need to allow that. That's a me problem. I need to allow people to have their feelings too. She's going to respond the way she responds because of her own thing. Just like I respond the way I do because of that. I should not have those feelings of rejection and abandonment, but it goes back to her threatening to leave us. She threatened to leave us multiple times as a family. Because she didn't know how to communicate effectively. And she still doesn't. She's better, but she still doesn't communicate effectively. And once she has something set in her mind, there is no changing that. Whereas me and my dad, we can see the other point of view. She can't. She's so closed-minded. So obviously there's some overlap in my trauma, and when I'm traumatized by one thing, it brings other traumas to surface as well, because I feel like I have to fix all of the problems all at once. It's just not possible. I just have to process things a little bit at a time until I can figure out something that I can cope better coping mechanisms. I'm going to go in there and love on my mom though, and go give her a big hug. And I just needed to talk about it, I guess, right now. This is a long video. But yeah, my EMG, it just went. I'm not able to talk much about the logic part of it yet because I'm still a little emotional, but once I do my research and start getting to understand the test and stuff again, and like, let's see what to look out for and figure out my next steps, because now that this is over with, I've got to move on to something else. But I also am giving myself the time and the grace and the patience today to process these feelings, and hopefully I can get working on my list of things to do. So I'm gonna go do that. Thank you all so much for watching my emotional video today. This is just how PTSD works with me. I have complex PTSD, and there's just so much overlap with triggers, and between the way I've been treated and verbally abused by various people in my life. You know, I do feel safe in my home. Some days I just want to stay in my bedroom and not talk to them, but I've been really coming more out of my shell again, because my major trigger of meeting my VA doctor has put most of that stresses aside. But moving forward, I am definitely more picky about the doctors I'm picking. So anyways, y'all have a great day. Have a great weekend. The weekend is coming up. I'm going to try and post some good funny videos or shorts, hopefully very, very soon. And hopefully I'm not going to be posting too many more long videos. I mean, I love posting, but like, you know, I need to try and stay off of my phone for a little bit making videos, because it's exhausting for one, and it takes a lot out of me to talk. It just takes a lot of breathing muscles and back muscles, and I'm already fatigued, and I'm still trying to catch up from all the lack of sleep for the week. So I'm really sensitive to everything still right now. But I'll be toughening up. I'll get better. This is only temporary. This too shall pass, and I'll be able to move on and communicate better moving forward. So thank you so much for listening, and blessed be. Have a great, great weekend. Peace out.